You're listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey, coming to you from our studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with chiropractor Dr. Larry Arbeitman. Dr. Arbeitman earned a Bachelor of Science degree in Kinesiological Science from the University of Maryland at College Park and graduated magna cum laude from Logan College of Chiropractic in St. Louis, Missouri. Dr. Arbeitman is the founder of Upper Cervical Chiropractic of Monmouth County, located in Marlborough, New Jersey, and has overseen more than 150,000 patients' visits in nearly 12 years. He has become well-respected within the profession, and most specifically the upper cervical specialty. He routinely trains, teaches, and lectures nationwide to colleagues, students, and the general public. He is an active board member for the QSM3 Upper Cervical Method. Today he will highlight several of his key points from his book, The Gift of Hope, The Path to Healing Through Upper Cervical Care. Dr. Arbeitman is widely considered to be one of the top chiropractors in the country, and he is also a contributing member of our national network of industry professionals. Today we're going to talk about a very important topic, corrective chiropractic care. Hello, Dr. Arbeitman. How are you today?
Hi, Liz. Great to be with you.
Thanks for joining me. So, what are the main principles of corrective chiropractic care?
Yeah, people hear the word chiropractic, and it really just brings up one thought in their mind. And for many people, it may just be a bad back or a bad neck or cracking of the spine. And it's really none of that. Really, if you look at chiropractic as sort of like dentistry, you got general dentistry and you got orthodontics. And if you look at chiropractic, a lot of the profession is doing what I call general chiropractic, where it's sort of patch care, and there's a lot of value to it. Somebody has a pain syndrome, and they're going to do whatever they can to help that person get out of pain as quickly as possible, and there's a lot of utility and value in that. The corrective care chiropractor goes a step further, where, much like orthodontists, we're looking at the root cause of what's causing the pain. And what we have found is there's certain biomechanical changes. We'll just call them misalignments or subluxations, where the spine has gone off from its normal position. And by being in this abnormal position for an extended period of time, it leads to progressive wear and tear, and then degeneration, and then perhaps arthritis, maybe even a herniated disc. And the corrective care chiropractor focuses on correcting those abnormalities in the biomechanics that is leading to the pain syndrome, so the patient doesn't end up on this sort of carousel. Now, just like the orthodontist who puts the braces on, and then they have to be tightened and checked, and it may take anywhere from 3, 6 to 9 months to maybe even a year and a half for those teeth to straighten. It's the same thing with the spine. Since we do an adjustment, we can't put braces around the spine, so it does require visits over time and constant checkups. But when we get to the point where we take another look at the spine, we're looking to see that these biomechanical changes, the twists in the spine, the curves in the spine, the tilts, the leaning off of center, that these underlying causes are actually corrected. And there's a percentage of our profession that consider themselves and practice this sort of corrective care chiropractic. Now, what's really important for a corrective care chiropractor to communicate to the patient is that not everything is correctable. The same way if you go to the dentist and you got a big gaping hole in your tooth, like you're not going to grow a new tooth. And so the degeneration and the arthritis that's there is not correctable. But if you can get the mechanics corrected, what I have found and many other doctors have found is that the progression of the arthritis, degeneration, or herniated disc can be significantly slowed down or stopped in its entirety. And I think that's the main difference between corrective care chiropractic and patch or relief care chiropractic.
Okay. And in what ways is a patient evaluated during a corrective chiropractic care visit?
It really goes back to the beginning of their intake into the practice and finding out what's important for them. And if the patient is interested in solely relief care, that's okay. But we have a duty to let them know what's available to them and what's in their best interest. And so it starts out with the consultation and the examination, where we're looking at things like chronicity, past trauma, how long have they been living with this condition and symptom for, and then we rely heavily on digitized X-rays. That the technology with X-rays is absolutely incredible, and it's continuing to grow in leaps and bounds. And so we just updated our digital system for the second time this year. And what it allows us to do now is take the entire spine, put it onto an X-ray, and measure to 1/100th of a millimeter these biomechanical changes. And so once we get the consultation and the exam and the X-rays done, we're able to make a very accurate recommendation to the patient of what it's going to take to achieve a correction or to patch their spine. And I kind of use those words. Some things are correctable and some things are patchable. For an 18-year-old who has no history of trauma, it may be just a couple of weeks or a couple of months. But for maybe a 65-year-old man who played football and fell off of scaffolding and has multiple herniated discs and severe arthritis, it could take 9 months, 12 months of corrective care. So we tailor that recommendation based on, again, the consultation, the examination, and the X-rays. Now, on a visit-to-visit basis, we're constantly evaluating the patient's nervous system, their posture, their alignment, their body balance, and there's reevaluations on a monthly basis. And eventually we're going to get to a point with that patient where we say, based on our daily checks and your progress to date, it's appropriate for us to take a follow-up set of X-rays so we can actually do an objective comparison. And I think that's a big difference. I consult with patients every month that have been to other doctors that tell me they weren't even X-rayed before they were adjusted, let alone X-rayed after the care to see what kind of outcomes. And I have patients also bringing in MRI studies, and they were compared to MRI studies from 6 years prior, and we're seeing on the radiology report that there's no progression in their degeneration or their arthritis over a 6-7 year period. And that's amazing. I'm thinking of one patient, Sue, who was told about 14 years ago that she'd have neck surgery within 10 years. And she just brought us in, now it's been 14 years and she hasn't had neck surgery, but she brought us in an MRI that revealed that there's been no progression in her condition. And that's somebody that's gone through the corrective process and then the maintenance process.
And my next question is actually about X-rays. I think you answered it, but I'll ask it anyway. Are X-rays required for corrective chiropractic care?
Yeah, we did just go there, and absolutely. I mean, how could you? That would be like a cardiologist not doing an echocardiogram or a stress test or blood work. How could you have a clinical objective and then not measure it? So I think measurement becomes a huge part of clinical practice. I mean, yeah, you can ask a patient how they feel, but that would be equivalent to you going to your internist and him saying, or her saying, how do you feel today? Well, I feel good. All right, well, come back when you feel bad, and then we'll do some tests. No, they don't do that. They do tests because sometimes some things are happening within your body that you don't feel. So just going based on how a patient feels, I think, is an incomplete strategy to caring for people.
And is this type of care recommended for people of all ages?
Yeah, it's interesting because as we take care of young moms and young dads and they see their spines in their 30s and 40s, they say to themselves, well, could this have been prevented? And oftentimes it could be prevented. And we talk about the same way we take our children to the dentist before their teeth hurt or they have decay because we're trying to prevent those things, that it makes sense to have the children checked. So we're seeing younger and younger children come into our practice for preventative checkups, and those young, healthy spines, they don't need corrective care because there's nothing to correct. They go right into what we consider wellness or maintenance care. The same way if somebody invests $10,000, $20,000 in correcting their teeth cosmetically, then there has to be some sort of maintenance after that. Otherwise, they're going to start to go downhill over time. And so I would say a lot of the children don't need corrective care. They go right into wellness or maintenance care, and even some adults. However, if you haven't been to the dentist, let's say in the first 20 years of your life, there's probably going to be some sort of correction that's needed. And so we do see a correlation between age, lifestyle, and past history of trauma to the spine that will determine the level or the amount of corrective care that's required for people. And what we do, a duty as the doctor is, again, to present the two types of care, general care or corrective care, and give the person, empower the patient, the opportunity to choose which is right for them.
Okay, and lastly, what are the overall health benefits of receiving corrective chiropractic care?
Yeah, and so the context of this conversation has been talking about getting the spine into better alignment to slow down degeneration and arthritis as much as it can be slowed down. And that would obviously prevent a lot of suffering in the future, because we know as a result of spinal degeneration and subluxation that can start to put pressure on the central nervous system, different types of nerves that can create all kinds of pain syndromes. But since the nervous system is the master controller of the body, and the health of the body, the adaptability of the body, the blood pressure, the digestion, the immune system, the hormones, the ability to relate to the outside world is all filtering through the nervous system, it just makes sense to, you want to keep the body healthy, you got to keep the spine healthy. The body will only be as healthy as the spine. And what happens over time, because we're all living in this world with gravity constantly pressing down on our bodies, we're all looking down at our cell phones, sitting in front of our computers, sitting in front of our laptops, the body is compressing. And what came out, a study came out in the Journal of Neurosurgery earlier this year that said spinal curvature, specifically in the middle back, has been linked to not bad health, mortality, like longevity of life, because as the spine starts to collapse, it presses in on the internal organs, the lungs, the heart. It pushes the diaphragm into the stomach. People develop GERD. It can raise the internal pressure within the body. So, everybody knows about the foundation of their home. They know about the balance of their car, and they wouldn't build a house on a crooked foundation. They wouldn't drive the car without developing problems on a crooked axle. What about our body? What about our body? So there are profound health benefits of going through corrective chiropractic care, not to mention the amount of money, time, energy, and suffering that will be saved by doing it now.
Well, thank you so much, Dr. Arbeitman. We know you're extremely busy, so I just want to thank you for your time and help today.
Oh, it's my pleasure to share these concepts with our community. Thank you, Liz.
And for our listeners across the country, if you are interested in speaking with the doctor, please visit www.getwellnj.com or call 732-617-9355 to schedule an appointment. Consultations with Dr. Arbeitman are always complimentary. He has never charged anyone to sit down and have a consultation in order to discuss their health needs and whether or not upper cervical care may be right for them. On behalf of our team, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading experts.
You've been listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.